gastrointestinal tract or your colon or anything?
Yeah,
that you
sometimes
know
I
of?
get like gas.
Okay. Do you take any medicine for your stomach?
No,
Okay. Have you ever had a colonoscopy?
no.
Oh, okay. Who's your primary care doctor that you see?
Garrett,
Where, Dr. Garrett? Okay. Has he done other testing for like colon cancer and stuff for you during the yearly, annual?
I
Jolene.
don't know, I don't
The
want to.
surgeon's here.
Oh, okay. All right. Good to know. Okay. So when they did your CAT scan, it looks like
Wait a
your
minute, you can
appendix
stay
got,
on.
inflamed. The appendix, if you were to look at it, it's a little organ that looks like a finger or like a pigtail. And usually it hangs right off of the large intestine where the small and the large intestine meet together. Kind of looks like a finger. And if you have a colonoscopy, you would see that on the inside of the appendix there's a hole there. And that hole allows poopy fluid to go into the appendix and then come right back out that same hole. So the entry site is the same as the exit site. It's like a blind ending loop.
You listening, Joe?
We don't really know what the appendix does, to be honest. We think it might be a lymphatic structure, kind of like your tonsils, to help you fight maybe a stomach bug or something. So sometimes
Yeah.
people get a swollen appendix if they're fighting a stomach bug recently. We see that a lot in kiddos. But we don't know for sure, what the appendix does. We do know that most patients, if they get into trouble and at some point it has to be removed, they do very well. There doesn't seem to be any of the sort of long-term consequences that we know of having it removed. But we think it's there just to kind of help infection. Sometimes it can get swollen though, like when you're a kid and you get your tonsils all swollen, and sometimes they have to do surgery to remove it, Sometimes that happens with the appendix. It can get all swollen. If we do nothing to the appendix, like no antibiotics, no surgery, no nothing, it can get swollen, and then like a balloon, it can kind of pop. And you can get pretty sick from that. And that's what it looks like has happened to yours. It's basically kind of popped a little bit,
Now, you're gonna do surgery today?
That's the question. So typically, if there's no what we call rupture of the appendix, we usually like to get in there with the surgery, cut it out and remove it. If it's already perforated though or ruptured, it's usually very difficult to do the surgery. So we usually like to hold off and do it like 2 to 3 months later, usually about 6 to 8 weeks later. We'll do the surgery, and that gives it time for the infection and everything to cool down, calm down. Now sometimes it doesn't cool down and calm down, and you do have to go to surgery anyway. It just is usually a riskier surgery. There's more risk of things like bleeding, residual abscess, infections of the wound, or injury to structures that might be next to the appendix, because it's all like a big hot mess in there. Your appendix is kind of interesting. Most of the time we see people have the appendix down here on the right side. Yours is actually up by your gallbladder.
Oh my God.
Have you ever had surgery on your belly before?
No,
No, okay. How's your stomach feeling this morning with some of the medicine they're giving you?
well, right now, it's still got a pain, but not
It's better?
anyway, not anything like I had.
Yeah. Do you
You
feel
wanna
like
let
the
you
pain
go,
medicine
John?
is helping?
Yeah,
Okay.
Good.
definitely.
Do you have any trouble that you know of with your heart?
I have,
AFib.
AFib,
Oh, okay. What's the blood thinner that you take for that?
Xarelto,
Xarelto. Okay. Did you last take that yesterday?
yes.
Okay. Yeah, you would definitely have a slight increased risk of bleeding from the Xarelto. So usually before surgery, we just want to hold that if we want to do surgery.
Yeah,
Do you take that twice a day?
no one,
Just once. Okay.
Oh.
Is that where you feel most of it?
yeah,
Up
but,
there. Okay. All right. Okay. Well, glad you're feeling a little bit better. Do you have any trouble with your lungs?
well, I have, liquid behind my lung, but, on this one, but, I went and saw, what do you call him?
Is it a lung doctor?
Yeah.
Oh,
And, he said that, I don't really need an operation to.
Yeah, there's
to
a
take
little
it out.
bit there. There's a little
He
bit
said that.
there.
yeah.
He says that it will be all right. I can live, as long as I don't have
Okay.
trouble breathing.
Yeah. Well, I see they have you on the oxygen right now. Do you use any oxygen at home?
No,
Oh,
the
okay.
only reason why they put it on because I said my oxygen dropped a little today. So.
Oh, has that happened to you before?
not that I know of.
Okay, do you have any sort of emphysema, COPD, any
No,
smoking
no.
history or anything? Okay, any history of stroke?
No.
Okay, no history of heart attack?
Heart attack? No.
Yeah, okay. As far as you know, kidneys are okay, liver's okay?
Oh, yeah. Yeah, I just had, Dr. Garrett took my blood work and stuff. He said everything was good.
Good, no liver disease that you know of?
No.
Good. And have you had any surgery at all? I see you're missing the tip of your finger there.
This and my,
Ankle, he's got a
Ankle.
screw in his ankle.
Ah, okay. So just kind of orthopedic stuff, I guess.
Yeah.
Okay. All right. Well, typically, if we get to this appendix, you know, before it's ruptured, we usually do surgery to go in there, take it out, and that involves usually just amputating it. And that is something that I think we probably could do. The only worry I have about doing that right now versus in 6 weeks from now is, you know, you're on the Xarelto, and so we would definitely have an increased risk of bleeding. And when it's ruptured like that, it's definitely much more difficult to get out. So there's usually an increased risk, you know what I mean, of either unsuccessful surgery, which I've had happen a time or two, where we just have to leave a drain and get out. Converting to open, which is where we can't do it successfully with the smaller incisions we call laparoscopically. Sometimes we have to make the bigger incision to get it out. So yeah, usually when it's perforated, we usually try to hold off and wait about 6 weeks and come back when the inflammation, everything is a little bit better.
Now, will they give him medication, or antibiotics and stuff?
Yeah.
Oh,
So
well,
that's what this is right here.
Right.
Yeah.
will that heal itself? I mean, what?
Yeah, usually the body will kind of wall it off and the infection will just start to heal up. Now you may get a little fluid that comes out and that collects into a pocket of pus around the abscess. That sometimes happens. And then usually what we do is instead of taking you to surgery to put a drain in, they actually can do it in radiology where they just put a drain in from the skin. And that usually can be really helpful too. So if we do the operative approach, which would be probably not what I'm recommending. I went over your CAT scan with the radiologist and it's definitely pretty perforated.
Yeah.
So I don't know how successful surgery would be. But that would be one option. Option two would be that you would stay here with us for 2 to 3 days while we give you IV antibiotics and watch you. Make sure that you are doing better, you are feeling better, the infection's getting better, antibiotics are helping. And then we would basically plan, if you're doing well, to put you on oral antibiotics to finish those antibiotics at home. And then you'd see me in my office and we would schedule you for the surgery roughly 6 weeks from now. Yeah.
Can I ask one?
Yeah, sorry.
Is there-
You're
no, it's
behind me. I didn't
okay.
just stand in front of you.
Is there any chance of him getting put on the antibiotic that ivermectin? Because it's
For
such
this?
a, yeah,
That's
because it's
the
such a strong,
Parasitic, that's not really antibiotic.
oh, okay.
Yeah.
Oh, okay.
I found him.
I was just curious, that's all.
Yeah, no, that's
Cause
more for like
I've read up about it
malaria
and
and
heard
stuff.
how it was such a good,
So what do you
Not
think
for
would be
this.
better,
Okay.
for him to stay here,
yes, Mom, that's
or
what she's
for
saying.
him to
For a
go
couple
home?
of days.
What do you think?
No, I wouldn't send him home right now.
Oh, she
Right,
wants to
I know
say a
that,
couple
yeah.
days.
Yeah.
But stay a couple, 2 or 3 days?
Yeah, that's what I would definitely recommend because, you know, if we're not getting better, then, you know, I think we would just have to say, all right, listen, we've tried these antibiotics, it's not working, let's go to surgery. Just
Surgery.
knowing that there might
So in a
be,
couple
you know, we
days you
would
can see if the
There's a
inflammation
risk,
infection was.
I have
afraid
a
of the risk.
question.
yeah, so, and we could hold the blood thinner to decrease risk of bleeding, you know what I mean,
Okay.
make things as safe as possible. But
How long does it
hopefully-
take for the blood thinners to get out of your system?
Usually for the Xarelto, we usually try to hold it for about a week. I think most of the time, you know, our surgeons and stuff who do surgeries wait about 5 days. For me, I would probably wait no less than 3 days ideally. Now, if we needed to do like an emergency surgery, like somebody needed surgery right now and they're on Xarelto, we would reverse that. But in this case, that's not really necessary. Yeah, we give a special medication. That's
Yeah.
for- yeah,
I have a
emergency.
question.
Sure.
So what would be the risk, because you say 6 weeks, right?
Yeah. Mhm.
So what are the risks, like, you know, that we have to,
No, once you're home, there's really no risk. Basically, we just want to make sure that you are doing well, and then when you go home, I would have every reason to expect that you're
The
going to continue
antibiotic will
to do
prevent
well.
any sepsis or anything.
Right, exactly.
Okay.
And then we
Okay,
would make
so we're
plans.
better off like having him stay for 2
Yeah.
to 3
Yeah,
days
so-
to make sure he don't go septic
Yeah.
and keep on the antibiotics with you people.
Yeah, that's a good idea,
now.
that's a good idea.
You keep saying it's a good idea to stay. Were they telling you to leave?
No,
No,
no, no,
no,
no, cause
no,
he's,
no.
we're just, he would rather be home.
Yeah,
But
Oh,
it's
I
just,
gotcha.
but it's,
Yeah.
you know, to have him
Oh,
here
no, I'd
is
rather
very,
be here.
Okay.
yeah. and to
So-
be-
No, I
Sure.
got you. Yeah,
Yeah.
nobody wants to be in the hospital if they don't have to
No.
be.
right,
No, so typically with this appendicitis, when we get to this early enough where it's not perforated, we go and we do surgery, and then most of our patients go home in a day or two.
oh,
That's what we
okay.
want to do.
Right,
But you're a little bit of a different, well, bit of a different situation.
well, he's a little bit
now
of a
for-
different kind of person anyways.
Yeah.
That's why his appendix is
That's
in
my
the
dad's.
spot.
Yeah, he's
Do you
stubborn.
have any diabetes?
Yes.
I was gonna say sometimes the
he's a
diabetes,
diabetic.
it's a little bit tricky for a few reasons. One is like you just don't feel pain the same way because you know the diabetes affects the nerves, and believe it or not, it even affects the nerves that go to things like the appendix or the gallbladder. So sometimes patients don't realize they have a problem with their appendix or a problem with their gallbladder because they just don't feel it
Right,
the
he
same
kept
way
saying,
What
until
a
they get
problem.
he just said he had a
that.
stomach ache, and he said to you
I
yesterday,
take-
we told him, you dad, you okay?
I take a Tenorol,
Yeah.
and that, ever since I've been taking that, it affects the nerves in my fingers and my feet.
Yeah, the tips of his fingers go numb.
Yeah, so I would guess that's probably why, you know, we didn't get to this early enough. Because usually when you have onset of symptoms, 1 to 2 days, you come to the hospital, it's not perforated yet. It usually takes 5 or 7 days for it to perforate. But I would guess it's probably from your diabetes. You just didn't feel it the same way, you know, that another person might until it got perforated.
Right,
It probably perforated and then you felt the pain because of the inflammation and everything around it.
Yeah.
Mine went in Hawaii, and I couldn't even walk. I was like,
okay, just forget
The
that.
appendix, the pain's a
Yeah,
little
it can
different,
be
like you
tough.
said.
Okay, so we.
So
But
we're
yeah,
gonna
and the
say
other
he's
thing
gonna
is, you know,
stay.
we have to be really careful about you, watch you really closely because of diabetes. Because if we just want to make sure your sugars are really good. Because if your sugars get really high while you're here with us, that's gonna affect how your body is able to heal the infection. You know.
Yeah,
Okay.
no
So
problem.
he's
Yeah,
gonna
I
stay,
mean,
he's gonna stay the 3 days.
That's what I would recommend is stay with
Okay.
us here for about 2 to 3 days. What we would do
Yeah,
in
I
the
know.
meantime, I would let him have something to drink as long as he's, you know, wanting to, and then eat as long as he's feeling okay. Usually we just start with liquids first in case you get a little sick to your stomach, just with the
couldn't
pain
eat that.
medicine and everything.
I couldn't eat nothing.
Yeah,
but,
and then when you feel ready, you know, as long as you're continuing to do well, we would give you some, you know, regular food like maybe tomorrow if your blood work looks good, no fevers, pain getting better.
Do I count?
What's that?
Do I count?
Yeah, the white blood cell count is like the cells
I
of
haven't
infection,
had no
inflammation.
fever.
What's that?
I haven't had a fever.
Yeah,
No,
so
he
we would
hasn't
just
had none
watch
at
you,
all.
make sure you don't develop a fever. What I would typically do is too, before we send you home, repeat the CAT scan to get a better look-see. Because sometimes even though there's no pocket of pus around it right now, in a couple days from now, before you go home and you're doing great, there might be one. And that's what I would want to look for and kind of either rule in or out. Because if there is one, we could put a drain in that before you go home. As long
Make
as
sure
you're
you don't get no
continuing to
infection.
do
It
well.
won't spread.
Okay,
Yeah.
well,
So I would repeat a CT scan. We would give you the antibiotics in the meantime, let you drink something, and then maybe in a day or two.
Well, at least you're being honest
I
and
have
not
a-
just doing it and.
I have another question. What's the
sure.
difference between doing the surgery now and doing it in 6 weeks? What makes the difference?
Because the body needs time to kind of cool down and
Get rid of the-
heal
to get rid
around
of the
that
inflammation,
tissue.
Chris.
When you go in and something is really infected or inflamed, all the tissue, it's like tissue paper, and things tear and rip and
Okay.
stick and bleed, and that's why it's a little bit riskier, because you're
Okay, I
getting the
gotcha.
increased risk of damaging something nearby you didn't mean to hurt, or at risk of injury, or, you know, spreading the infection and things like
They
that.
want the
Okay.
inflammation to go
I
down,
gotcha.
Yeah.
so it's the best.
Yeah, that would be what I would recommend, you know, is to see. But again, if we are not getting better, then I
Right.
think we would still have the option of doing surgery. Regardless, just kind of knowing it would
3
be.
days gives the
Difficult.
antibiotics
Just makes it
time
a
to
little
work.
easier to move around in there if the inflammation and all that's not there.
Yeah, basically,
Yeah.
usually it's called an interval appendectomy, is what that's called.
Right.
And that's usually done for perforated appendicitis, and that's usually 6 to 8 weeks.
Will they give him his
Okay.
insulin and stuff? Yeah,
Yeah.
okay.
Okay,
Right.
well, we thank you for being
Yeah, we
honest
appreciate that, thank you.
and
So I can have some water then.
Yeah, yep.
What about his pain?
Yeah. I
Like-
want him to be comfortable, so we usually order some pain medication, and then usually as the infection starts to get better because of the antibiotics and his body just healing
they'll
it, sugars
slowly
being
bring it
good,
down.
his pain should get better.
Yeah.
Oh, okay,
Day by day.
okay.
And they'll
Okay.
start bringing down
Yeah.
the intervals of the
Mhm.
medicine.
But right now, you know, he's gonna need it, so he's welcome
Right,
to take the
right,
pain
okay.
medicine, yeah.
Okay,
Okay.
just
Before
wanna
he
make
goes
sure.
home, I wanna make sure that his pain is gonna be well controlled without needing any IV pain.
Awesome, okay, great.
Okay, great.
Well, I
Okay.
thank you,
You're welcome.
thank you very much. I heard good news about you,
Oh, that's good.
yeah.
What other questions do you guys have for me before I leave you? Anything?
Nothing, we just,
I just wanna get this behind me.
Yeah, well, I'm glad you're already starting to feel a little bit better. We're
yeah,
gonna
here's John.
watch your vital signs and watch lab work and keep the antibiotics going. But yeah, I'll order you some liquids to drink. That way, you know, you can wet your whistle. And then we'll check on you tomorrow.
Alright.
All right,
Thank you so much.
Thank you. It's nice
Again,
meeting
my
you.
name's
Thank
Dr.
you.
Marshall. Just have him call me. if
Nice
you
to
need
meet
anything.
you.